Welcome to another episode from the Veterinary Research Channel. Today, we delve into the fascinating world of equine neurology, focusing on a specific condition affecting young Egyptian Arabian foals, Juvenile Idiopathic Epilepsy, or JIE. Recent research has shed light on the characteristics of this condition, offering insights into its diagnosis and potential parallels with self-limited epilepsy in children. Our story begins with a puzzle. Seizures and epilepsy, while relatively uncommon in horses, present a significant diagnostic challenge. Among equine epileptic disorders, juvenile idiopathic epilepsy stands out as a well-characterized condition. It's identified through clinical observation, neurological examination, electroencephalography or EEG, and histopathological examination. But what exactly is juvenile idiopathic epilepsy? In Egyptian Arabian foals, it manifests early in life, typically between 2 days and 6 months of age, with a median onset at 2 months. What's particularly intriguing is that these foals appear to recover fully, showing no long-term effects by 1 to 2 years of age. Researchers have not identified any sex or coat color predisposition, nor any specific events that trigger the condition. Clinically, juvenile idiopathic epilepsy presents as sudden, generalized tonic-clonic seizures, where the foal loses consciousness without any warning signs. Following a seizure, it's common to observe cortical blindness, disorientation, changes in behavior, difficulty swallowing, and an unsteady gait. Cortical blindness, the most frequently observed sign, can vary in duration from a few minutes to several weeks, but vision typically returns within 24 hours in most foals. Importantly, between seizures, these foals appear neurologically normal. The prognosis for survival and a return to normal physical activity is generally good, provided that complications such as head trauma, corneal ulceration, and aspiration pneumonia are promptly managed. To fully understand and classify epileptic disorders in veterinary medicine, electroencephalography is essential. Juvenile idiopathic epilepsy seems to have a familial component and is suspected to be inherited in an autosomal dominant pattern with a self-limiting course. Scientists have been working to pinpoint the genetic cause of JIE in foals. Now, let's explore how researchers have been working to refine the classification of epilepsy in these foals. A recent observational, retrospective case control study reviewed clinical and EEG data from foals at 2 institutions. The study included Egyptian Arabian foals with a history of witnessed or video-recorded seizures, or EEG evidence of epileptic discharges reviewed by a neurologist. Healthy, age-matched Egyptian Arabian foals with no seizure history served as controls. The researchers carefully searched electronic databases for terms related to seizures, epilepsy, convulsions, paroxysms, photic stimulation, electroencephalography, and EEG. Before each EEG study, the foals underwent physical and neurological examinations by specialists in large animal internal medicine. A board-certified veterinary neurologist often conducted the EEG evaluation. Medical and EEG records from healthy, non-epileptic Egyptian Arabian foals within 1 year of age were also reviewed as controls. The institutional animal care and use committees of the participating institutions approved the study protocols. During the EEG studies, foals were sedated to minimize movement. Depending on the institution, sedation protocols involved intravenous xylazine hydrochloride or ditomidine hydrochloride, or sublingual ditomidine hydrochloride followed by topical lidocaine cream on the scalp where electrodes would be placed. Electroencephalograms, or EEGs, were performed while the foals were standing under sedation. The EEG included electroocculograms to monitor eye movement, electrocardiograms to monitor heart function and respiratory monitoring. The EEG machines used had integrated photostimulators and video recording capabilities. Electrode placement followed a modified 10 to 20 system, common in human EEG studies. Disposable subcutaneous needle electrodes were carefully placed on the scalp, maintaining equal distances between them. The EEG recordings lasted 40 to 50 minutes, including 20 to 30 minutes of sleep induced by sedation, followed by periods of drowsiness and wakefulness. Because foals can enter slow-wave sleep while standing, this was taken into account. Slow-wave sleep was identified by background slowing, vertex sharp waves, sleep spindles, or K-complexes. The researchers looked for specific patterns in the EEG, such as spikes, sharp waves, spike and wave discharges, or multiple spike complexes, all of which can indicate epileptic discharges. Epileptic discharges were classified as focal, multifocal, or generalized. A veterinary neurologist and a human medical neurologist jointly reviewed the EEG recordings. It's worth noting that the examiners were aware of the foal's clinical status, as the foals were being evaluated for seizures. Activation procedures were used during wakefulness, including intermittent photic stimulation, sound stimulation, and hyperventilation. Intermittent photic stimulation involved flashing lights at various frequencies. Sound stimulation consisted of a loud clap. Hyperventilation was induced using a plastic rebreathing bag. After the EEG was completed, the electrodes were removed and the scalp cleaned. Turning to the results, the study classified 48 Egyptian Arabian foals as having juvenile idiopathic epilepsy and 21 as non-epileptic controls. The JIE group included 25 fillies and 23 colts, with a median age of 2 months. Most JIE foals had affected siblings, and no coat color predisposition was evident. The control group consisted of 12 colts and 9 fillies, with a median age of 3.5 months. A subset of these foals had affected siblings. Clinically, the majority of JIE foals experienced generalized seizures, while some had focal seizures. Seizures were characterized as violent, generalized tonic-clonic events with facial motor components. Focal seizures involved facial motor alterations like trismus, chewing, and tongue paresis. Seizure duration typically ranged from 20 seconds to 2 minutes. Postictal signs included disorientation, obtundation, cortical blindness, and ataxia, with cortical blindness sometimes lasting for weeks. Most JIE foals were treated with anti-seizure medication for a few months, and most responded well to monotherapy with phenobarbital, levetiracetam, or gabapentin. Some foals required multi-drug combinations. A few foals did not receive anti-seizure drugs because of the low frequency of seizures and the associated costs. Seizure-related complications included body trauma, head trauma, aspiration pneumonia, and corneal ulceration. Electroencephalography was conducted on 37 JIE foals and all 21 control foals. Most JIE foals had been tapered off anti-seizure medications before the EEG study. The EEG recordings captured states of wakefulness, sedated drowsiness, and sleep. During sleep, the background EEG activity showed intermittent delta activity. Vertex sharp waves, sleep spindles, and, rarely, K-complexes were observed. Interestingly, second-degree atrioventricular block was noted in most foals during slow-wave sleep. Interictal epileptic discharges were observed in the majority of JIE foals. Focal spike N-wave discharges were common, typically originating at the central vertex with spread into the centroparietal regions. These discharges were seen predominantly during sleep, but also during wakefulness. Ictal recordings were obtained in only 2 foals, showing a focal onset at the central vertex with subsequent generalized spread. Most control foals had normal EEGs. However, a few control foals displayed occasional focal spike and wave discharges, and all had a family history of JIE. Auditory stimulation did not elicit any electrographic changes in either JIE or control foals. Intermittent photic stimulation resulted in photoparoxysmal responses in a significant percentage of JIE foals, but rarely in control foals. These responses were reproducible and time-limited. Normal photic driving was more frequently observed in control foals. Hyperventilation did not trigger epileptic discharges. The study confirms that epilepsy in Egyptian Arabian foals with JIE has a focal onset of epileptic discharges in the central vertex, which then spreads to other cortical areas, resulting in generalized seizures. Interictal EEG recordings consistently showed focal epileptic discharges in the central regions of foals with JIE. Epileptic discharges were recorded during both wakefulness and sleep. Photic stimulation frequently induced a photic response in JIE foals. Interictal EEG examination helped identify epileptic discharges in some colts with no apparent history of seizures. These colts had a family history of JIE, suggesting that the condition is likely inherited with incomplete penetrance. This means that EEG abnormalities might be inherited without the development of seizures. The absence of interictal EEG abnormalities does not rule out epilepsy. The standing sedation and EEG protocols used in this study allowed the researchers to obtain interpretable data with minimal movement artifacts. Because specific stages of sleep are known to facilitate epileptic activity and seizures, avoiding general anesthesia is important when performing EEG studies. The use of alpha-2 adrenergic agonists facilitated slow-wave sleep without altering the EEG findings. Based on clinical manifestations, seizures in these foals originate in the vertex centroparietal region and therefore are considered a focal onset epilepsy. Abnormal activity can spread from its origin to other regions of the brain. generalized spread of epileptic discharges resulted in clinical seizures in 2 foals while recording their EEG. The study also emphasizes that abnormal EEG activity can occur during the interictal phase, and the lack of epileptic discharges during recording does not rule out epilepsy. Juvenile idiopathic epilepsy has similarities to self-limited epilepsy with centrotemporal spikes, previously known as benign Rolandic epilepsy, which is the most common epilepsy in children. Similarities include early onset, self-limited nature, and no apparent long-term consequences. Rolandic epilepsy is so termed because the origin of epileptic discharges is at the Rolandic area of the brain around the central sulcus of the brain. Because of the anatomy and shape of the horse's head, EEG recording from the temporal region is not possible, and parietal recording is the closest to this region. Self-limited epilepsy with centrotemporal spikes is classified as genetic and suspected to have a dominant mode of inheritance. Juvenile idiopathic epilepsy is suspected to be a genetic epilepsy with a dominant mode of inheritance based on pedigree analysis, in which a sex predilection has not been noted. Furthermore, EEG of asymptomatic first relatives of patients with self-limited epilepsy with centrotemporal spikes has been reported to show epileptic discharges, which also was observed in this study in some asymptomatic foals with affected siblings. The use of animal models to investigate the underlying etiology and mechanisms of pediatric epileptic syndromes is mostly limited to experimentally engineered or induced models. Therefore, based on similarities such as being a self-limiting disorder with an early onset of seizures, seizure seismology, and EEG findings, foals with juvenile idiopathic epilepsy might serve as a naturally occurring animal model for self-limited epilepsy with centrotemporal spikes. Activation procedures used for the investigation of epilepsy during EEG recording included photic stimulation, sound, and hyperventilation. No alterations of EEG activity were observed upon sound stimulation or hyperventilation. Photic stimulation is widely used in routine EEG to aid in the diagnosis of epilepsy in humans. Photic driving as observed in these foals also can be observed in normal foals and is not considered pathological. Limitations of the study included the lack of ictal recordings. However, such recording was precluded because of safety concerns and the unpredictability of epileptic episodes. Lack of epileptic discharges does not rule out epilepsy as shown in 2 foals with juvenile idiopathic epilepsy. Horsehead anatomy and increased likelihood of movement artifacts prevented EEG recording from the temporal region. Furthermore, clinicians were not blinded to the clinical status of the foals examined because foals were presented for seizures. In conclusion, this study reevaluated epilepsy in Egyptian Arabian foals with juvenile idiopathic epilepsy and determined a focal onset of epileptic discharges in the central vertex with spread to other cortical regions of the brain, resulting in sudden, violent, generalized tonic-clonic seizures with loss of consciousness or focal facial seizures. Epileptic discharges were seen during wakefulness and sleep, but predominantly during sleep, which alpha-2 adrenergic agonists promote in equine species. We can also conclude that epileptic discharges were triggered in most foals with photic stimulation. Juvenile idiopathic epilepsy appears to be inherited as a dominant autosomal trait, likely with incomplete penetrance resulting in some asymptomatic foals based on the presence of epileptic discharges upon EEG examination. Electroencephalography is crucial to identify and classify epilepsy correctly in foals with juvenile idiopathic epilepsy and constitutes the basis for accurate future genetic studies. Furthermore, foals with juvenile idiopathic epilepsy might serve as a naturally occurring animal model of self-limited epilepsy with centrotemporal spikes in children because of similarities in seizure seismology. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.